Assalamu alaikum, Iyaka Nabdu wa Iyaka Nasta'in. Welcome to my channel, Dr. Shami says. So I couldn't find the SK latest series having the recalls from the FEP papers, but I have found a PDF containing the important questions uh, which could be termed as the recalls from the FEP. So uh, let's just start. The question number 1, the loss of anchor reflux. Ashley's reflex is the indicative of damage of which spinal nerve root, that is S1. Structure that passes through the adductor canal is spared from the damage when the canal is injured. Which of the following structure is most likely to be spared, that is the saphenous vein. Damage to the extensor compartment of the leg wound most likely compromise the blood supply from the anterior tibial artery. Damage to the apex of heart would most likely compromise the blood supply from the anterior interventricular artery. The type of necrosis typically seen in the heart is the coagulative necrosis. Coagulative necrosis is typically characterized by the preservation of the cell outlines and the tissue artery texture. Characteristic of apoptosis are the ladder pattern DNA. Which of the following tumor markers is most commonly associated with the pancreatic cancer, that is the CA19.9. The pancreatitis is an example of which of the necrosis, the fatty necrosis. The tumor marker of the hepatocellular carcinoma is alpha protein deficiency, of which enzyme is associated with the increase is emphysema, particularly in the smokers, alpha-1 antitrypsin. Damage the obturator nerve, which would result in the loss of motor supply to which of the following muscles, that is the gracilis. The primary lymphatic drainage of the prostate glands occurs through which of the following lymph nodes? The internal iliac lymph nodes. The lymphatic drainage of the labia majora primarily occurs through which of the following lymph nodes? There is superficial inguinal lymph nodes. The lymphatic drainage of the ovaries primarily occurs through which of the following lymph nodes? That is the para-aortic lymph nodes. The patient was diagnosed with the carcinoma of the breast having the pubis oris appearance. Distortion of systematic ligament of the breast. The PHSCs of the breast is typically associated with the ductal carcinoma in situ. In viral meningitis, there is an increase in the CSF production due to the increased permeability of the blood-brain barrier. The patient having the fever, neck rigidity, and the slight shortness of breath in the CSF, increased lymphocytes, normal glucose and proteins 400, that is the tuberculous meningitis. The patient presents with aspirin toxicity characterized by the metabolic acidosis and dysbiosis. The following treatment is indicative to help manage the acid-base disturbance, that is a sodium bicarbonate infusion. The patient presents with the aspirin toxicity, the arterial blood gas, and the electrolyte values are as follows. This is basically the metabolic acidosis. The patient presents with pneumonia characterized with the mucoid discharge. The following bacteria is most likely responsible for the infection: the Klebsiella pneumonia. The patient presents with the pneumonia gram stain of sputum disease, gram positive organism. The organism is a catalase negative, which is the following bacteria most likely responsible for the infection: the Streptococcus pneumonia. An immunocompromised person presents the diarrhea. The stool sample is sent for the analysis. Z-Nielsen staining reveals the donut-shaped cyst. The donut-shaped cysts are found in the cryptosporidium. The patient presents the chronic diarrhea and the villus atrophy. The symptoms are not liver with the gluten-free diet. The pathogen most likely responsible with the Giardia lamblia. The key difference between the eggs of the Taenia saginata and the Taenia solium is the Taenia saginata eggs are round, while the Taenia solium eggs are oval. The tumor located the porta patus is most likely to compress with the following structure. There is a portal vein. The cancer located at the head of the pancreas is most likely to compress with the following structures. There is a common bile duct. The patient presents the loss of sensation the dorsum of the base of the thumb. The following nerve is most likely affected: the radial nerve. The 45-year male presents to the pharmacy with the complaints of the weakness in the right hand, stating that he is unable to extend his wrist and the fingers. The mentions a history of prolonged alcohol use and sleeping in an awkward position on his arm after drinking the previous night, saturated night palsy, that is the radial nerve. Wrist drop occurs due to the damage of the which nerve, that is the radial nerve. Which structure passes over the flexor retinaculum, ulnar nerve, and the artery. The patient presents with the loss of the finger abduction. Which the following nerves is most likely affected, that is ulnar nerve. Which class of the immunoglobulin is primarily responsible for providing the long-term immunity against the reinfection, that is IgG. Antibody in the acute transfusion reaction is the IgM. Anti-basement membrane antibodies are the Gush-Pasteur syndrome is an example of the following hypersensitivity, there is a type 2. The patient presents the blocked ureter, which is the following effects of renal functions would you expect? Decreased GFR, decreased filtration fraction, and the decreased uterine output. Lymph flow will be decreased by the hemorrhage. The patients with the sickle cell disease, where are sickle red blood cells primarily destroyed the spleen and its sinusoids. The patient presents the typical lymphocytes of the following investigation. The best initial test to confirm the presence of typical lymphocytes is the peripheral blood smears. The varicella zoster infection can reactivate and cause herpes zoster along specific dermatomes. If the rash is distributed in the face with the following nerves is most likely involved as a trigeminal nerve. Incisional hernia occurs through the weakness in the abdominal wall. Typically, the site of previous surgical incision to the following layers is usually the first to protrude through the abdominal wall. Defect in an incisional hernia, that is a fascia transversalis, which anti-aging vitamin deficiency presents similar to vitamin B deficiency, B12 deficiency, but without neurological symptoms, the vitamin E. The patient undergoes a surgical resection of the terminal ileum. Which of the following vitamin deficiency is most likely to occur as a result of this resection, that is vitamin B12 deficiency. The patient undergoes a total pancreatectomy. Removal of the pancreas of the following vitamin deficiency is most likely to occur as a result of this surgery. Vitamin D deficiency. What is the most likely diagnosis in the patient presenting the recurrent jaundice, elevated indirect bilirubin and the low hepatoglobin levels, that is the hemolytic anemia. 35-year-old female presents with obstructive jaundice, which is the following the most likely cause of her condition, the gallstones. The patients with the liver fibrosis, which have the connective tissue is predominantly present, that is the collagen type 3. A patient in the operation theatre develops low blood pressure. Following anesthetic agents is most likely responsible, that is the propofol. So the following food items is commonly associated with the Bacillus cereus food poisoning, that is the fried rice. Patients with the blood pressure of 90/40 per of 1 to 5, estimated percentage of the blood loss, that is the 20 to 30%. The coronary sinus develops from which of the following neurological structures? Left horn of the sinus venosus. The cerebral veins are actually an extension of which of the following structures? Dural venous sinuses. The newborn presents with the unilateral defect in the upper limb, which is the most likely diagnosis, the unilateral cleft lip. 25-year-old presents with the polyuria, polydipsia, weight loss. Labs reveal hyperglycemia, metabolic acidosis in the ketonuria, which is the most likely diagnosis. Diabetic ketoacidosis. Enzyme deficiency is responsible for the von Gech's disease. That is a glucose 6 phosphatase. The patient is diagnosed with type 1 hyperlipidemia, which dietary restriction is most appropriate for this condition. There is a restriction of the dietary fat, particularly long chain triglycerides. Newborn presents the craniosynostosis, mid-face hypoplasia, and the high arch palate. What is the additional feature most likely associated with this condition? Alport syndrome, there is a syndactyly. What is the most commonly used when for the grafting the coronary artery bypass grafting, the peripheral vascular surgery, that is the greater saphenous vein. The patient had eaten fried rice 6 hours ago, present the nausea, vomiting, diarrhea. The cause is the Bacillus cereus. 40-year-old patient presents with the hypertension, abdominal pain, and the hematuria. Ultrasound reveals the multiple cysts in both kidneys. What is the most likely diagnosis? Adult polycystic kidney disease. The 30-year-old present with the family history of the kidney disease based on the flank pain and the hematuria. Imaging studies reveal the multiple cysts in the both kidneys and the liver, that is the adult autosomal polycystic kidney disease. The disease is inherited in autosomal dominant pattern, which is the following the characteristic of this inheritance pattern. The disease is expected in both heterozygous and homozygous individuals. Disease is inherited in autosomal recessive pattern. The disease is expressed only in the homozygous individuals, which is the following cranial nerve nuclei is involved in the regulation of salivation. Its dysfunction can lead to xerostomias, that is the superior salivatory nucleus. What is the preferred method for securing the airway in a patient with suspected cervical injury? The oral endotracheal intubations with the cervical immobilization. The following is most likely cause of pulmonary infiltrates in a patient with the Hodgkin's lymphoma being treated with the ABVD regimen. The bleomycin, which is the prime mechanism by which the low dose aspirin inhibits the platelet aggregation, the inhibition of the thromboxane A2. 30-year-old man is involved in the high road traffic accident and is rushed to the hospital despite the absence of the external signs of head injury, including no lacerations or fractures. The patient remains unconscious and later diagnosed to be in the vegetative state. But the most likely cause of the patient's condition, diffuse axonal injury. 25-year-old man is brought to the emergency department after a motor vehicle accident. Examination open his eyes to verbal command. Utters incompressible sounds and localizes to pain. The Glasgow-Coma scale is 10 in this case, with the most accurate diagnostic test for the asthma spirometry. 5-year-old child undergoes tracheostomy with the prolonged respiratory failure. Post-op, child experiences significant bleeding from tracheostomy. What is the most likely source of bleeding in this scenario? The innervate the brachiocephalic artery. Neonate present the diarrhea after feeding. Diagnose Nikas stool test is performed. Substance exists in the stool. Diagnose the condition, that is the reducing substance lactose in the glucose. Man 55 years old with a GERD undergoes endoscopy with the Barrett's esophagus. High risk for developing this type of cancer would be the adenocarcinoma. Enzyme responsible found in the snake venom is all of these: the phospholipase, collagenase, and the protease and peptidases. 20. A week pregnant woman is taking new mercazole, which is the carbimazole. For the hypothyroidism, what should be appropriate treatment adjustment? Continue the same treatment. Patient with hypothyroidism has already started treatment and is due for the follow-up. The following test is most appropriate for the monitoring the effectiveness of the treatment. That is the thyroid stimulating hormone. The group of the climbers is planned to ascend a high altitude location, which is the drug choice for the preventing and treating the acute mountain sickness. That is the acetazolamide. The patient presents the thyroid tumor that involves the C cells. The medullary carcinoma MRI of chest and the abdomen is performed on an elderly patient to evaluate for the age. Later changes. Calcifications are seen. Calcification of the coronary arteries, mitral valve, and aortic calcification, which is one of the primary action of the insulin. That is the glycolysis. Loss of accommodation reflex lesions is in the cerebral cortex. The patient undergoes a cervical biopsy and subsequently experiences numbness and the weakness in the arm, which nerve is most likely damaged. That is cervical sympathetic trunk. The pregnant woman with the Rh negative blood type develops antibodies against Rh positive blood of her fetus. This leads to the breakdown of fetus red blood cells. What is the most likely cause of this condition? Anti-D IgG. 40-year-old male presents with the severe abdominal pain and the vomiting. Laboratory results shows the acute pancreatitis. One molecule of the glucose breakdown into water and the carbon dioxide. Total ATP would be 38. The patient presents with the hypertension, hypokalemia to the excessive aldosterone production. To the following diuretics most suitable for the treatment. That is the spironolactone. The patient with the congestive heart failure in the fluid overload, which course of diuretics most effective for the rapid reduction of the fluid volume. That is the loop diuretics. Patient presents the severe abdominal pain, the peritonitis due to the perforation in the posterior wall of duodenum, which artery is most likely to be involved, the gastroduodenal artery. 35-year-old patient admit the hospital for surgical procedure and subsequently immobilized for an extended period, which is the following is significant risk factor for developing DVT. That is the prolonged immobilization. 30-year-old presents in the emergency department the sudden dyspnea, chest pain, tachycardia. Long history of the travel, that is the pulmonary embolism. Excessive thirst is damage with the falling hypothalamus, that is the paraventricular nucleus. The patients undergo thyroid surgery and subsequently develop the harshness in the vocal capacities. The nerve most likely damage the external laryngeal nerve. A 28-year-old pregnant, symptoms of hypothyroidism, tachycardia, tremors, weight loss. Preferred line of treatment would be the propyl thiouracil. 25-year-old patient presents the trichia purpura and the low platelets with the following diagnostic test is most likely from the underlying cause of the patient's symptoms. There is a bone marrow biopsy. During laparoscopic cholecystectomy, the surgeon must be careful to avoid use of the following structures in the close proximity to the cystic duct, the right hepatic artery. 35-year-old woman presents the history of the recurrent DVT, pulmonary embolism. The body test revealed the presence of the lupus anticoagulant anticoagulation antibodies. The following medication most approved for long-term anticoagulation in this patient, that is the warfarin. The patient the Christmas disease, hemophilia B, presents with the severe bleeding. Following product is most appropriate for the major management FFPs. This is the following bacteria most commonly associated with the subacute endocarditis, that is Streptococcus viridans. The patient presents the weakness in the abductor shoulder joint while the movement limited to 15 degrees. The following muscle is most likely affected, that is the supraspinatus. A patient presents the fractured talus bone, which of the following structure is most likely to be affected. There is a medial arch. The patient presents the sensory loss from the chin to the suprasternal language of the following spinal nerve levels is most likely responsible for this sensory deficit. That is a C2, C3. During cholecystectomy, the drain is typically placed in the following locations to prevent the bile leakage. Right subhepatic space. What is the type of epithelium that lines the esophagus? That is the stratified squamous non-keratinized epithelium. 107. Which of the following new antihypertensive drugs can cause the hypoglycemia? That is the propranolol. The sodium potassium pump transports potassium ions potassium against their concentration gradient. The hydrogen potassium ATPase pump in the stomach is an example of the primary active transport. The nuclear differentiation grading invasion to surrounding tissues, lactate dehydrogenase. 110. Acanthamokeratosis is a serious eye infection associated with the contact lens water. In the pregnant woman, low level of the alpha fetoprotein in the maternal serum is associated with increased risk of the Round syndrome. 114. The Phocomelia is congenitally anomaly associated with the presence of the flipper-like limbs, hormone activity of the lipoprotein lipase, insulin. 116 30-year-old woman present the weight loss, buffalo hump, purpose trias, etc. That is a Cushing disease, oblique sinus. 118 vancomycin is typically dosed at the 10 to 15 mg per kg. Landmark for the pudendal nerve block is the ischial spine. The ischial spine is an important landmark for the performing a pudendal nerve block. Protoplasm is primarily composed of water, and the second most common constituent is proteins. The patient presents with the sway, eye pain, blurred vision, headache, nausea. Intraocular pressure is elevated in the anterior chamber is shallow. What is the most likely diagnosis? Acute closed angle glaucoma. The esophageal opening in the diaphragm is typically located at the level of T10. The sinus glands in the ear are responsible for producing the wax. Hand-foot genital syndrome is a genetic disorder which is characterized by erection of the hand. 1 to 5. The squamous cell carcinoma is characterized by the presence of cat and pearl. The squamous cell carcinoma is often associated with the production of the following. That's the PTH. Karachi, Pakistan, and cancer is most important. There is oral cancer. The patient presents with the white lesion in the oral cavity cannot be removed by rubbing. The most likely diagnosis is the leukoplakia. Hodgkin's lymphoma is typically classified based on the histological type. During strenuous exercise, the partial pressure of the carbohydrate in the blood decreases. Prostate cancer most commonly arises in which zone of the prostatic gland? That is the Pfeiffer zone. In infertility clinic, the woman uses the strip to detect the luteinizing hormone. The radiograph of the bone shows a mosaic pattern of the bone. This is the most commonly seen in the Pegas. Each of the following ligaments provide stability to the shoulder joint. That is the glenohumeral joint. Which of the following ligaments is most commonly injured in the clavicle fracture? That is the cracoclavicular. The approximate volume of the ECF in the adults would be 14 liters. The following structure prevent the backflow of the feces in the large intestine, the small intestine. That is the ileocecal wall. The gastric ulcer with the shoulder joint pain. Acetaminophen, the carbimazole, is known to induce the metabolism of other drugs. Which of the following types of receptors are affected by the capsaicin? That is the nociceptor, which is a type of intestinal cell responsible for parasitic antigen to the immune system. The MSL, the damage to the lower trunk, the brachial plexus, most likely affect the function of the which muscle? The flexor carpi ulnaris. The patient has a very prothrombin and activated partial thromboplastin. Which of the following is the most likely deficient? That is the factor X. Lytic bone lesions are typically seen in the multiple myeloma. What is characterized by the proliferations of the kappa cells, M cells. A 60-year-old patient presents the lytic bone lesions, anemia, and the hypercalcemia. The most likely diagnosis is the multiple myeloma. 30-year-old patient presents with the microangiopathic hemolytic anemia, thrombocytopenia, and the renal failure, fever, and the neurological symptom, which is the most likely diagnosis. Thrombotic thrombocytopenia purpura. A lesion involving the iliac crest and surrounding tissues is most likely the osteosarcoma. The patient with the acute intermittent porphyria requires anesthesia. Which of the following anesthetic agent is contraindicated? Thiopental, which when thrombin acts on the fibrinogen, it releases which of the following peptides to stabilize the formation of the fibrin? That is the fibrinopeptide B. The lymphatic drainage of the inner canal below the pectinal line is primarily to which of the following lymph node groups? The superficial one lymph node. The patient with the rotor extension shows an elevated hemidiaphragm. The chest radiograph of the following nerves is most likely affected? That is the intercostal nerve. The patient presents the symptoms of hyperglycemia, laboratory with low glucose level, increased insulin, and elevated peptide levels. Most likely insulinoma. Which the following drug is responsible for secreting the hormone epinephrine and the norepinephrine? That is the adrenal gland. 25 female with the weight loss, palpitation, heat intolerance. Lab reveals elevated T3, full decreased TSH. That is the Graves' disease. The patient presents the related urinary diagnosis, the tuberculosis feedback mechanism defect affecting the constitution of the following be expected findings in the patient's urine. That is the low urinary sodium. The most common source of thromboembolism is the deep veins of legs. Lines of Ziehen are typically seen in the arterial thrombus. The half-hour unconscious patient is brought to the hospital. That is the CNS ischemic response. The patient's present with the low blood pressure and low pulse rate. Which of the following anesthetic agents would be the suitable for this patient? That is the etomidate. Proto-oncogenes are normal genes that regulate the cell growth. It is defined as the normal genes the cell proliferation. Scar that extend beyond the original margins of the wound is characterized. That is the keloid. The white infarct is typically caused by the arterial blockage. Antibiotic use against bacteria cause pseudomonas. Colitis is the clindamycin. The drug of choice when to be histolytic infection. The metronidazole. Walkman's canals are located in the compact bone. The oblique and the transverse canals in the bone are known as the Walkman's canal. 169. What Prevents the filtration activity charged proteins such as albumin through the glomerular basement membrane, that is the proteoglycans. Characteristic biochemical finding: the urine of the patients with the maple syrup urine disease in the presence of the branch chain keto acids urine. Which of the following arteries are most commonly associated with the intercerebral hemorrhage in the hypertensive patients? That is the lenticulostriate arteries. I see a bleed. Which vertebra compressed to stop bleed? There is a C60-year-old man is in the hospital with certain onset of difficulty speaking and understanding the language. He also has the weakness in the right. What is the most likely location to the brain damage? Left cerebral hemisphere. What is the primary purpose of karyotyping? That is identified chromosome abnormalities. 55-year-old patient diagnosed with pancreatic cancer. The patient asks about the prognosis. Which should the doctor consult the patient about the pancreatic cancer? There is a poor prognosis with the limited treatment options. 35-year-old man presents in the emergency department with the sudden onset of the dyspnea, chest pain, tachycardia, oxygen saturation 88 on room air. The most likely diagnosis is the pulmonary embolism. Which type of the wound is typically closed by the primary intention? That is the clean wound. The characteristic feature of the wound healing by the skin intention that distinguishes it from the primary intention is the excess inhalation tissue. A student in the final year MBBS witnessing surgery for the first time collapse in the OT due to the decrease in the total peripheral resistance, which is the following anti-tuberculous drug is commonly used with the color V and deficiency. There is a thumbutyl amniocentesis typically formed for the genetic testing at the 15 to 18 weeks. What should be done if the syringe becomes contaminated? During the procedure, replace the syringe with another one. 184, the following bacteria is known for producing foul-smelling compounds, that is Bacteroides fragilis. Which hormone plays key role in the stimulating thirst? The angiotensin 2. Which artery is the risk of injury? The suprapubic incision, that is inferior epigastric artery. Best diagnostic for the inverted nipple is the clinical examination, the compression. What is the approximate rate of regeneration of the neuron? 0.3 mm per day. Which ECG finding is commonly associated with the digoxin toxicity, that is the biphasic TV, which is the primary reason for elevated ALT, AST levels in the blood, that is the membrane damage. The patient underwent hysterectomy, lesion of ureter, where it can be damaged during the hysterectomy when it moves upward and laterally behind the broad ligament. What is the common complication of total parenteral nutrition? Hyperglycemia. Falling muscle exhibits an action potential with the plateau phase. The cardiac muscle mechanism action of antimyosin is the inhibit electron transport chain complex 3. Last but not the least, the patient the multiple centimeters from the blasting injuries requires surgical removal. During the procedure, surgeon opens the pericardium and moves her fingers behind the apex of the heart until it reaches the oblique sinus. That's all from this paper. Thanks for watching my video. Do subscribe my channel. Until my next video.